My name is Aimee. It's French.
In my years doing mobile geriatric dentistry to the various nursing homes, I would have met Mrs. Malcolm there and seen the issues that she presented with, and I wouldn't have been able to physically treat her in that facility. I wouldn't have been able to put her in a dental chair with the light. I wouldn't have been able to remove a 6-unit fixed bridge. I wouldn't have been able to remove a badly fractured upper incisor, especially with all of her bleeding, clotting issues, and we were able to do that here.
She had been diagnosed with a number of problems with her teeth, and our dentist, Dr. John Glennie, recommended Runnymede Dental Center because Dr. Archer specializes in geriatric dentistry. Plus, my mother has a number of health issues that mitigate how she is to be treated, and Dr. Archer was able to provide that.
You know, if there was a blood condition issue that arose, the bleeding, so on and so forth, it's like a hospital. So we were fairly assured that, you know, nobody would be running around, you know, for a bag of blood or, you know, a pole or something. It was here, and that, you know, I think with Aimee, what we want to do is make sure that it's one-stop shopping, because it is an effort for her, you know, to get in and out, and she loves it, but it's tiring.
It's easily accessible for her. It's not far for her to have to walk from the wheelchair parking area, and it's directly into the office. The staff is extremely supportive and cheerful, and has made all of us, including my mother, feel very welcome and cared for.
When we saw Mrs. Malcolm a few weeks back and we were doing the treatment and making some recommendations, I was noticing their note-taking, and both of them were taking notes. And they have these books which are wonderful and indexed with heart and eyes and teeth and other. And you know, I pick out this teeth index, and there are all the different notes about my contact information, the medical history that Mrs. Malcolm is on, some of the instructions that they were given, and I thought this was so fantastic. Every day and every week at this clinic, we see families with one caregiver or perhaps no caregivers. And so sometimes there's a little bit of a disconnect or loss in the information that we're providing. And in terms of providing best quality care, this is a great system that I was so impressed with that I think they just came up with on their own. But I think for any kind of daughter or son or relative out there bringing anybody to the dental clinic, this is a great system. Okay. So Aimee has lots to smile about, and you've got your brand new smile. We've done a nice, the latest and the greatest, an all ceramic bridge at the front, and so she's got a real fixed solution for her dentistry there. So congratulations.
Well, thank you.
You're welcome.